You are muted. Okay, so Nandita, maybe you can go out and come back again, and then we can shift to Nanette if her.
Hello? Am I audible? Hello?
Do you hear us, Nanette?
Yes, I can hear.
Yeah.
Am I audible?
Yes. Could you please, give your answers or what is your preference?
All right. So actually, in the Philippines, in our institution, we have emergency medicine. Prior to the pandemic, we have emergency medicine exposure during our clerkship and internship year. So in general, the clerkship year is that time where we try to learn the skills and that's when you try to know how things work in the hospital. And then when you get to the internship year, that's when you're already given the responsibilities. So I think it's similar to what some of them are suggesting. However, that one's prior to the pandemic. But now, since we're limited to online, I'm not sure how we can catch up with the things that we've missed.
I think, Nanette, you may not be far away from getting the experience that you need. I think you're in your fourth year at the moment. Is that right, Nanette?
Yes.
So if in your fourth year, I think you probably have another opportunity, from what I understand of your medical program, in your final years and in or your internship year, to spend some time in the emergency department. Um, Keep your spirits up, because I think things are starting to come to a point where hospitals and universities are more confident in bringing their students back to the clinical setting. Certainly, I can share with you in Singapore that our students are back, and our students
Mm.
are back and very well educated in infection control procedures and putting on PPE, etc. And I think one of the things that they feel more confident is that uh, you know this is not going to be the only time where we will need to have our students look after patients who in a pandemic. This is not the only time. They're going to be junior doctors, and they're going to be looking after patients who in another pandemic, in a future pandemic. So I think giving them the skills to do that and making them more confident, I don't see that as any different from you know getting confidence around good procedures, or getting confidence around looking after patients who are have undifferentiated complaints. So I think just hang in there, Nanette. I think it's not long. It's not long before
Actually,
you.
that's something we're very excited and hopeful to finally get to experience it for ourselves.
Yeah, that's one thing I do want to, if you're like me, and I don't know whether this was inspired also, you were that inspired as well, Scylla, is, that enthusiasm. I mean, certainly in my time, we derived our inspiration from ER, the TV series ER. I know you can now tell how old I am, but the, so the series ER, and I think, okay, that's great. There's going to be some people that are going to be uh, inspired by this kind of media, and therefore go on to do emergency medicine. But there are going to be others who will be doing emergency medicine, a vast majority probably, that will not be doing emergency medicine as a career. Maybe you can share with them what kinds of experiences they would get out of their emergency medicine rotation that would actually stand them in good stead in the future, as doctors. Because I think we had a chat about this, I think, before the session began, that, there are experiences within an emergency department that it's valuable for all students. So, Stella, maybe you want to start off?
Yeah, that would be great. Like when I can say that, like, when I finished emergency medicine clerkship, I was fully satisfied that, like, I was both grown as a human being and as a doctor to be. And how did that happen? Actually, you get to see patients in the worst case scenarios at the red zone especially, and you learn how to handle those situations, those critical situations, in a really calm manner. And when you get into the field by yourself, every doctor is going to be in, like, could be in that situation in the future, where you're by yourself as the leading doctor, and you need to act like an orchestra chef and deal with that critical situation in a calm manner to go to reach to your goal. And emergency medicine is kind of a rotation which gives you that. It teaches you how to act like an orchestra chef. This was my very first question to the EM specialist when I entered to the department. I was like, how come you guys act like that? Like, you guys are so calm and deal with all of that chaotic situation and make it a comfortable environment, a learning environment for us. At the same time, they teach us, they do the invasive procedures, and, like, from that, every student can take out this lesson that, like, you should be calm under critical conditions, because when you're calm, everybody is calm. And you, after you handle that situation, you will get the highest satisfaction. And what else they can take from out of emergency medicine? For me, being bound to emergency medicine actually taught me to how to triage the important tasks in my life and sort out them according to their severity. Like, this is the most important one, so I need to handle it at the first place, and the least important one, I will deal with it later on. And another important thing was the fact that you learned critical thinking, and at the same time you learn how to handle those critical situations. So, like, I would also wonder, like, how Nandita has a take on this question, and I'll be more than happy to hear her answer about it. So, how was it for you, Nandita? Like, what do you think students will take out of emergency medicine clerkship? Like, all of the students, not just the ones who are really interested with emergency medicine.
Well, I feel that emergency medicine is the only place where they actually taught us how to read and interpret an ECG. And there's so many theoretical aspects that we only learned while we were posted in emergency medicine department. In addition to this, like you said, a lot of life skills and a lot of like it helps us develop as a doctor overall. It helps us to learn how to work in a team because this was the only department where there was an increased emphasis on the roles played by all of the members of the health team, be it the nurses, the paramedics. In fact, our college has a WHO approved emergency medicine nurses training program. So we learned a lot from the nurses and we learned how to work together along with them to deal with these kind of critical situations. So that is an important thing that we learned from this department. In addition, I would say that they taught us how to work in resource poor settings. Like it's not just that every time we have all of the facilities available to us, all the scans and everything. So they even taught us like if we were in a scenario where none of these things were available, like in rural areas or if you're working in a tribal area, how do we deal with this kind of critical situations in those cases? So overall, it was a really good experience, I would say, and it is valuable for us regardless of whichever specialty we would take up in the future.
Yeah, I think that's really important, actually. You just brought up a really important point. We're really privileged to work with a great team in the emergency department. It's not just about me, doctors. It's actually about the entire team. We're talking about nurses. We're talking about, the OTs, physios, the allied health. We're talking about, our administrative, the people that work in administration as well to get our patients registered. We also work with, a whole range of other subspecialties, people from outside of the emergency department. And we actually mustn't forget that because at the moment we are going through COVID, we often forget about the people that make the difference. So, how many times did the emergency department, research room had to be cleaned? And to our cleaners, I'm very grateful because they had to turn around our resus rooms, our resuscitation areas really quite quickly. And they're putting a lot of effort into ensuring that the patients have a positive experience within the emergency department. So yes, we are very privileged to work with teams. And I guess that's the next question I actually wanted to ask Nanette. I guess we could discuss this, but Nanette, what's your experience about with working together as a team as a medical student? Do you get any other experiences, having not been in the emergency department, for your rotation or your posting? Do you get an experience where you are able to work together with other teams?
So far in our current rotations, we have limited opportunity to work with students or even professionals in other fields. But actually, I've heard from senior students that when we when we get our community rotation, that's when we get to maximize working with other people. So yeah, that's something we're really looking forward to.
Yeah, I think that's I guess that's one of the key elements of that, having that live experience, is actually having being able to work with other members of the team. Thank you, Nandita, for bringing that up, because I think we often talk about emergency medicine as an exciting field, procedures and lots of knowledge, interesting ECGs and all that, but we actually forget that human aspect, that we're still working as a team, and we are working together to look after our patients, and so that humanistic side of emergency medicine, I think it's just as important. um, I think we what are your thoughts, Alpa?
Honestly, I definitely agree with you all. I just want to ask one question related to their emergency medicine experience, or maybe any clinical experience. Of course, we discussed the COVID-19 that caused many issues already, but besides the COVID-19, as a medical student, what do you think the challenges in the emergency department setting for you in terms of getting better education? Any challenges that you faced, and any recommendations that you can say from your experience? Let's start with
Well,
Nanette.
okay.
I think you are muted, Nanette.
I think you're muted, Nanette.
Sorry, sorry. Okay, I think one challenge that we encounter is that right now, in the online setting, a lot of students are complaining about being in Zoom like for the whole day. So I think that's one problem that all of us are experiencing right now. Like most of our meetings and our lectures, they're all being done online. And currently, the lecture type of teaching is not very effective with the students now. So a lot of students are looking for other resources online or
Yeah, I think they call it Zoom fatigue. There's a term like this, as far as I remember correctly. Yes, we are all Zoom fatigue, MS Teams fatigue.
For us as well. I mean, this is
New normal
I've
now.
been Zoom for now 7 hours in with probably an hour's break today. So yes, it is actually quite a real thing.
It is real. How about Nandita? Any challenges that you experienced during the emergency medicine training?
I would say that like this is not during our emergency medicine training, but in the future, if suppose I, as a medical student, would like to take up emergency medicine, there are various challenges that are unique to our country. For instance, in our country, emergency medicine was recognized as a individual specialty only in 2009, when the Medical Council of India approved the MD Emergency Medicine course. And even now, almost 10 years down, 10 to 11 years down the line, we have only a very few colleges offering this course, and we have each year, I guess, only about 196 graduates graduating from government colleges after having completed a post graduation degree in emergency medicine. And this is incredibly, I would say there's a huge shortage of emergency medicine doctors in our country, because we have a massive population of 1.39 billion people. And even today, the leading causes of death are ischemic heart diseases, injuries. And so there is increasing need for emergency medicine doctors. And where we need about 130,000 emergency medicine physicians, we are hardly having 196 doctors graduating each year. And many of the seats are also left vacant for some reason. So I would say that the main challenge in our country would be to have a standardized curriculum for emergency medicine, and also increasing the interest among medical students for the specialty, so that more of us begin to take up this course in the future, and also increasing the number of seats for the specialty, because we are incredibly understaffed as far as emergency departments all through the country is concerned. So this would be the main challenge as far as India is concerned.
Yeah, I think you touch very important point. It's not just there are some issues in the undergraduate emergency medicine training for all medical students. It's also there is issues in some countries having less number of residency programs, and of course the residency the positions for the future specialist. I agree with you. And India is a very big country, and I believe many hospitals everywhere around the country, and probably most of them has emergency department or emergency room. I don't know how we can define, but definitely need specialty care for their patients, and without having enough number of manpower, trained for emergency medicine. So it's really difficult to deal with every single patient. I definitely agree. Of course, you are saying this as an India is a different, let's say, example, but very interesting that some other countries actually they don't have that experience. They, I mean, in their medical, the school, for example, they born into that system, and everything is established. Everything is actually stepwise approaches in there, and system is very developed. And of course, their experience is totally different than us. So maybe James, one of them. I think that in Australia, you did your residency in Australia, right, James? And
yes, so it's actually quite different in Australia. So when I trained when I did my training in Australia, we didn't have a formal residency program. It was run out of the college, Australasian College for Emergency Medicine. So it was a centralized training program of 7 years at the time. And in that sort of 7-year period, you progress through sort of basic training to a transition year called the provisional year, where you had to complete an exam called the primary exam and gather 3 references, structured references, before progressing. And that's changed a bit, but I'm just talking about my own experience. And then subsequently enter what we call advanced training, which is 4 years at the time. Many of us did more time than this strict 7 years to gain experience in different places. For example, I did neonatal medicine or neonatal intensive care, and I did retrieval medicine as well. So that was a great experience, but that extended my training up to 10 years. So what I would say is that it's a different sort of approach to training, not necessarily a fixed time residency. The advantages of that and advantages of residency programs. Yeah. But I think what it is probably about quality of the experience. You could be, we talked about this,
Yeah.
how many weeks you spend in emergency medicine. If your the quality of your experience is actually not great, through the lack of staffing, lack of supervision, you may actually end up with a poorer experience, over an 8-week period, for example, than someone who spends 2 weeks in emergency medicine, or who are well supported,
Yeah.
well supervised, well looked after, and engaging our students,
Yeah.
on the floor. So I think that the issue around timing is probably a little bit um, it's a little bit more difficult to fix on what's the ideal timing for emergency medicine. But I think it depends on the quality as well. But I think, Nanditha, I really want to talk about this. I know time is moving along, but I really want to talk about this because Nanditha is bringing up a really worldwide problem: shortage of emergency physicians.
Yeah.
Is that really about the shortage? Perhaps it's about globalization. It's about emergency, people who want to train in emergency medicine moving to other countries. And then once you spend time in other countries, you tend to end up staying there. And that's a loss. If it's someone from India, a graduate from India going somewhere else in the world, that's a loss for India themselves. So it's that whole concept of trying to retain your medical graduates as well within the country and supporting them to train within the individual country itself. I think that's really interesting.
It is.
We've got a couple of students here, Scylla and Nanette, who are going to probably graduate fairly soon. What are your thoughts? Are you going to stay in Turkey, Scylla?
No, my plans are actually a bit interesting. I'm planning to move to US and proceed in my career in that country. And like I'm planning to pursue my career in emergency medicine field. And in Turkey, apparently, working here as an emergency medicine specialist is a bit risky because, like, from the things that I have seen during my clerkship, I was a bit afraid because the patients can be quite aggressive towards you. And actually, one of my conversation with one of our EM specialists was that, like, I don't want to stay here as an EM specialist because or do my residency here because of the fact that we had to look at the patient, like deal with the problems of the patient who have insulted one of us, one of our EM specialists. Another colleague had to deal with that patient, and that wasn't the only case. Like you give a bad news and you get the bad news for yourself too, and like like want to break the windows and everything. So it's been interesting in here. So maybe someday I will come back when I do get my education at the United States. But afterwards, like now I cannot speak for like what will happen in the future. My only plan is to go move to United States and pursue my career there.
Yeah, I think this the violence in the ED thing is a reality, and it's actually growing
Mm-hmm.
around the world, I believe. And I don't know. We all know the the doctors or people from the Philippines always smile, and or they are always, kind. Don't get me wrong, we are all kind, but there's a universal understanding that Philippine people are kinder than you. So is this happening in the Philippines also, Nanette? Is this an issue in the violence in the ED? I don't think so. I hope not. But what do you say?
Actually, Filipinos are, I think, well known in other countries as being kind and polite. Not just doctors, but also other professionals all over the world. Actually, in the Philippines, we also have the problem of a lack of doctors, ED doctors in the Philippines. I think one cause is that there are very few hospitals that have emergency departments in their in the hospital, and because of that, there are also very few hospitals that offer residency programs for students to specialize. And then so yeah, that's attributed to the lack of emergency doctors. And then most doctors actually would prefer to seek further studies abroad since they have better fellowship programs and more developed fellowship programs. So we always have that issue of brain drain where our professionals would rather go to other countries to specialize and then eventually work there. So yeah, that's an issue actually, not just for medical professionals but also those in other fields. In terms of violence, I'm not sure if there are any, but right now I think the issue is with more on social media and privacy. Like there's been issues where patients take videos of um, medical professionals and then post about them and they post bad things about them and then it becomes viral and then suddenly a lot of people are aware of that issue and then yeah, there are a lot of patients that do that and some doctors face that problem.
Yeah,
I think
I think.
violence is a real issue, isn't it? I mean, violence is a real issue in all emergency
Yeah,
departments. It's sad, but it is increasing, and I don't think, being in the US, isn't it probably a lot different? I think there's a lot of violence, interpersonal violence, as well as violence against
yes,
as I said, healthcare workers, across the world. We are not immune to it in Singapore either. We always look at Singapore as a safe place to live. And yes, it's generally safe. But as healthcare workers, we also have to be very aware that violence is a real issue and it is increasing in emergency departments. It's really sad to hear that for Scylla, that you
Mhm.
have that intention to leave Turkey to actually explore residency somewhere else because of the situation there as a result of violence. Um, what about yourself, Nanette? Are you going to stay in? You going to remain in the Philippines when you complete your medical school?
Um, yes, I'm planning to stay here since there's a lot of work to do and there's so much that actually, yeah, I feel like we are more needed here in the Philippines.
Yeah, yeah. Yeah, I think it's a personal decision, and there's probably no right or wrong answer. What about Nandita? What about yourself in terms of what are your future plans in terms of staying in India?
Well, when it comes to learning emergency medicine, I feel that our country still has a long way to go as far as standardizing the emergency medicine curriculum is concerned. So, if I would like to pursue emergency medicine in the future, I would most probably like to do it in the US, just like Sila mentioned. But
Yeah,
um, but after that, I would definitely want to come back and work over here, maybe even teach and try to build up a good emergency medicine curriculum in my country too. So, this
yeah.
is what.
I think that's great, to have that view of coming back, which leads us to the next thing, which is a good segue. How can we as an international community support you better as students and future doctors, in emergency medicine?
Well, first of all, I would like to say that the IEM has done a wonderful job of providing free resources for students, especially during the COVID times. This is really useful for all of us. And I think it needs to do a little more in promoting the fact that these resources exist because most of the students in my college, I'm sure, are not even aware that such a resource exists from where we can learn. So I think one way of doing this in India, especially, would be to conduct some maybe quizzes or like like international level quizzes or even national level quizzes. That is really something that catches the attention of students in India. So then that makes us aware that yes, these resources are available and we can also access these. So that would be one way in which you can increase the knowledge of students about these resources in India.
yeah. Thank you. Yeah, we are trying to actually collaborate with different partners, and we are inviting the blog authors from different countries and trying to reach their associations or student groups to share this, resources with everybody. But I think the social media is amazing. I couldn't believe that we can reach that amount of collaborators, contributors around the world, and it's growing really. I mean, currently, I guess we have 203 contributors to our resources from maybe 32 countries at the moment. I'm not sure, but it's counting every day. So I think more than 30 country contributed to our resources, and we are looking for more, of course. And recently, we are planning to update our free emergency medicine collection book with multiple collaborations around the world. And of course, you guys all invited with your, supervisors and everything. They can help us. And also, we are also actually creating one MCQ book for the emergency medicine, which is we have a lot of resources, but we just need to get them together and review it, and then to make it more useful and the easy to use for you guys. So hopefully good things will happen, and this project is growing, and we have support of IFM always, and we have other associations in the sport. So with your sport also, I think it's going to be big, slowly, but steady and to the right direction. I think we are happy. What do you think, James? I think we are happy.
Yes, I think you've come a long way, Alpa. Your leadership around the IEM project has really come a long way. I think we were sitting in a room, if I'm not wrong, in Cape Town during one of the ISOM conferences where you presented
correct.
the IEM project in its infancy at the time. It actually was quite well developed, but it's in infancy at the time. So when we think about that time and sort of 6 to 8 years on, I think that it's really, really grown. I think that's where the next phase of this whole project is, how to engage our students within that IFEM community as well. After all, they are going to be our future. They are going to be the future of IFEM. So I think that's where we need to go.
Yeah.
Do you think it's a good time at the moment to talk about what we're planning for ISOM 2022, our medical student summit?
Yeah, why not?
So
definitely.
we are putting together a medical student summit to engage our students across all 7 regions, all 7 IFEM regions, to share with us their experiences, their challenges, but importantly, what we as an international community can do to help them. So we're organizing this summit, and I hope I'm putting a call out there that please go to the IFEM or ISOM 2022 conference website and take a look. Hopefully we'll see you there at the conference. If you're only able to attend the summit, that is great as well. We would welcome you there. And I think a couple of us here are going to be, Scylla, I think you're involved. Is that right?
Yeah, it's right. And I'm pretty excited about it.
Yes. So Scylla, I think you are involved, and certainly I think we were trying to get students from all 7 regions. I think it will be a great event, and we hope to see you all there. And perhaps that's a way of actually having IFEM more engage or engaging our students, to engage our students a lot more in the international community.
Yeah. One thing maybe I can say, James, because we are just talking about this, getting together and, creating something. I think that Asia is having the most representation in IFEM in terms of the country representation.
Yeah.
I think it's the more than 20 countries already represented in IFEM. And as we discussed, maybe in the live session or before the live session, I'm not sure, but there is no student association in Asia.
Yes.
And if we get our students together in under one umbrella, maybe it can be Asian society or maybe it's IFEM, I don't know, but it can be great to get them together first and then produce with them something meaningful for future. Of course, individual contributions are always welcome, but it can be very great to see the Asian students get together in one, umbrella for themselves and connected to one of the associations, and they're working for the future, the emergency medicine. I think Africa is doing great job about this.
Yeah.
They have amazing the student group, and we met with them also, and they're all bright like you guys and doing amazing things. Now I'm actually following their activities. They're sharing in the Twitter and everything. It's amazing. So why not Asia? Don't do it. So it's yeah.
I think Axel might be watching. So if Axel's
Hopefully,
watching, maybe
let me ask.
Yeah.
Let me ask before. Are you watching us? If you're watching, you hear us.
should really ask whether it'll be great to have a student association or student committee under the banner of the Asian Society of Emergency Medicine. So I think that would be great to get together the students and that community, to set up that community of and I guess 20. You were saying 20 countries within Asia. More than 20 members. So I think that's a big portion. So that's a great idea. Let's get Axel involved.
Yes. Yes. I will give the Axel communications to you guys, so you handle it.
Actually, I have a question to both Nandita and Nanette about the FOMED sites. Like, how did they use it throughout their education while they were in the EM or during their internship or during their other clinical rotations? Because it helped me a lot. And like having especially a FOMED site at your native language is actually a really helpful thing, because like you don't have to translate it immediately to your superiors about the knowledge that you get out of from that FOMED site. And how did you guys actually use it? How did it help to your education? And like what were the ways that you actually get benefit from it? Because I really wonder, for me it was like my third arm. Like I was always keeping it handy and checking every single condition, like how can I approach it, and like for the treatments, for the differential diagnosis. It was there for me for the updated information for every single question. So what about you guys? Nandita, like how was it for you? Did you get any benefit out of it?
Honestly speaking, we don't use FOMED that much as medical students. We use something called UpToDate for all the other subjects, but we don't generally, we're not very exposed to FOMED resources for emergency medicine. And I came to know about it only once I was invited for this conference as a speaker. So I think there needs to, I need to create some more awareness amongst my fellow students, and we all need to use FOMED resources more.
Definitely. What about you, Nanette?
Similar to Nandita, we also use the same. We also use UpToDate, and since our institution actually has partnership with the UpToDate, most students have access to it. So I think it's a good. I think one good step would be to reach out also to educational institutions. We're maybe partner with them. And in terms of FOMED, I've actually only learned about it now. But then looking back, I realized that most medical students in the Philippines are already using FOMED. We just don't know it's called FOMED. So,
I think it's actually just about having things in your toolkit, right? So FOMED is one thing in your toolkit. UpToDate, it's another good online resource that's in your toolkit. In fact, the African students actually, when we met up with them as one of our first meetings, they said, "What about books? We like the hardcover books." So I think it's just something in the toolkit. Foam is really important, and foam ed is really, really important resource, educational resource. But I guess it's not the only resource. Parts of
Mhm.
Africa, for example, had access to internet wasn't great, so they reverted back to pencil, paper, books, and I think that's a very reasonable approach. It's probably what is feasible in your setting. It's nice to hear that there's a range of tools out there that everyone's using to learn, um, and I think that's really important, just to keep it to keep it broad, and to contextualize what's useful and what's not useful in your setting.
Exactly.
So, Alpa, I think time is coming
Yeah,
to an
time is
end.
just right time to
Yes.
say the final things, and then we can close. Actually, I'm checking. Is there any questions anywhere? So
Mm.
far, I didn't see any questions, and so. But yeah, what about the final word? So what we can say?
Yeah, let's give our students the final word. Let's go from the other way this time. And our screens were always going one direction. Let's go the other way this time. Let's go Nanette first. Nanette, you start us off. Some final words.
Well, first, I would like to thank the IFM for this opportunity. Actually, I've been really excited to learn about medical student education in other countries. So it's been very interesting to hear about their different approaches and how it is in their countries.
Thank you.
Mm,
And Scylla, what about yourself?
well, emergency medicine for me is one of the most important 15 minutes of all of the specialties, because you get to deal with the patient, touch more lives than compared to any other specialties. So it's such a fascinating field, and I'm looking forward to participate in more events like this, which can help me collaborate with people and students who are especially interested in EM all around the world, because it's such a great feeling. And I thank you, both of you, and every single person who is also at the background who helped this project come alive. And thank you all, guys. Thank you, Nandita. Thank you, Nanette, for the beautiful chat. And what about you, Nandita? Like, what is your last words for the meeting?
I would hope that emergency medicine becomes a well-known specialty that garners students' interests, and hope to see it flourishing and becoming a mainstream specialty that many medical students would love to pursue in the future. And I hope many more people would be bitten by the infectious enthusiasm that we have for emergency medicine and the passion that we have for the subject. So thank you so very much for inviting me for this conference, and thank you, Sila, thank you, Nene, thank you, James, thank you, Alpha. Thank you for this wonderful discussion.
Thank you, Nandita, Scylla, and Nanette, for having this chat with us. We always love chatting with our students. Every now and then, this is our fifth one, and it's been a very different experience every time. So, we're really grateful that you've, stepped up and, willing to share your thoughts with us. And, it's so refreshing to hear from our students from all over the world. So, the challenges, the kinds of experience that they have, the challenges that they face, and the kinds of things that they would like from us, or would like us to help them improve their experience, and what we can do as an international community. So thank you so much for being here, and thank you, Alpa, for inviting me again. It's always enjoyable
Always.
having that.
Without you, we don't do this. And yes, I share the same feelings with the James. Thank you so much for your time, and you shared amazing experiences with us, with the audience, and hopefully every time actually we learn something from here. But somebody in somewhere else, so they get some idea and maybe they can implement something what you said today. So I think it is always a great experience, and of course you are all welcome to contribute to IEM education project, which is you contributed now, but for the other activities. And definitely we are looking for you to see you in the IFEM's activities as a student attendee or maybe speaker in the future events. And thank you very much again. So I think we can.
I think
Yeah.
we should. We've got about. You were saying we've got probably about 200, 300 participants on the platforms.
Yeah,
at
the,
moment.
the website. Yes, let me
Yeah.
check. Yeah, I think
So I guess we should. We need to thank our audience.
audience too. Yeah, yeah.
With us and participating together with us, and thank you so much for being here and listening to what your fellow colleagues, students have what their thoughts are. So thank you for attending this our coffee chat, for coming to the coffee chat itself. So we hope to see you at the next one.
Next one, hopefully. So enjoy the rest of the day. Thank you very much.
Thank you. Thanks.
Bye-bye.
Bye.
Yes, we come to the end of this session. Please don't forget to subscribe to IEM-student.org or IEM-course.org platform so you can get some information about our activities. And actually the best way to get the information about our activities is actually following us on Twitter. So we frequently announce our activities in there. So until the next time, I hope you have a great day, month, and a year. See you in the next